Friends, today we are going to talk about dengue and chikungunya in Delhi. It has become a focus of the media. We are not going to talk in political terms, in blame game, state, union, or the MCD, but we are going to talk in a reality context as to how we can manage it and how we can avoid it and what we should do to avoid a similar thing next year. As seen, garbage E-Delhi fight against flu starts here. It says it's well known that trash kept in open can become a site for mosquito breeding, yet carelessly thrown trash is everywhere. Citizens reporters have been sending us images of piles of garbage from across the city. If Delhi is to get serious about controlling diseases, it must clean up its act fast. And this is one of the pictures of Dwarka Sector 7. As you can see, this is some area in Press Enclave, a lot of garbage. This is also one of the areas in Subhash Nagar and all. So let us see the next. So these are the clips taken from various newspapers. Now we can see Subhash Nagar, a lot of drainage, dirty water, a lot of garbage piled up around the dirty water. Delhi is well known for its number of cars, four-wheelers. It is said the number of four-wheelers in Delhi are more than the number of four-wheelers in Bombay, Calcutta, Madras joined together. Recently in the paper it was there that in Delhi on every 1,000 people there are 5 cars, but when it comes to hospital beds it's not even 2 per 1,000. So that's the miserable state. Now let's see what next we have to see. Now this is another photograph, again Subhash Nagar. Bikaji Kama place is a very good office place, commercial place. A lot of offices are there. Here we can see a lot of garbage piled up. This is one of the Karaval Nagar and Defense Colony, the most posh area of Delhi. A lot of garbage. Now let's see the next one. Oh, whoever has come to Delhi knows what a very narrow place and what it is famous about, and we can see a lot of garbage piled up on the road. Now this one, it is well known that trash kept in the open can become a site for mosquito breeding, yet carelessly thrown trash is everywhere. So this is one of the repetitions of the photographs. Now this one, low fogging in Ghaziabad, which saw the first death, says few of the residents. So this is one of the places. So actually when we say Delhi, it's Delhi NCR, which means to say Delhi, Gurgaon, Faridabad, Ghaziabad together, and the problems are similar. So yeah, now Chikungunya toll doubles to 10 as Apollo reports 5 deaths. So as of now there have been 10 deaths due to chikungunya. This is one of the photographs. I have taken this clip from Times of India dated September 15. Fumigation is going on everywhere. Now that chikungunya and dengue has been highlighted by TV channels, so the government has also become active. Now the ministers are being questioned, some get irritated, some pass on the buck to other, union to state, state to MCD. But as we know, the sufferer is the public. I will also blame media in the sense that if they knew, as we all know, that the situation is really serious, so why they did not become active earlier? So now that we know that government becomes active only when the media is active, so why not the media becomes active earlier? Let's go for the now see what's next. Now, yep. Virus strikes around Delhi best hospitals. Chikungunya, AIMS vicinity is ground zero of the disease. So this is one of the clicks in Hindustan Times dated September 16. So even a body like AIMS, there are so many breeding places around AIMS itself. When we say AIMS, it's one of the autonomous unit under the union government and is considered the leader when it comes to health. The genius among the doctors come from AIMS, but the when it comes to social service to the community, it sounds zero. So we must not only concentrate on tertiary care, we must also look after the preventive health. Now another clip. It says it's in Hindustan Times and it says all India Institute of Medical Sciences, the area around All India Institute of Medical Sciences like Ayur Vigyan Nagar, a residential colony housing doctors and staffers from AIMS and neighbouring Gautam Nagar and Masjid Mode have recorded the highest number of chikungunya cases in Delhi this year. This is according to the data provided by the municipal agencies till September 10. Now, what to do? What to say? Now, the services of AIMS are within the parameters of AIMS wall and not adjoining it. Now, let's see. Let's not only focus on AIMS. Purpose is not AIMS, but dengue and chikungunya. Now, this is the picture just outside the AIMS. As you can see, this is one of the metro stations. A lot of people are sleeping. Now, this is one of the clips in Hindustan Times dated September 16. Now, many come to Delhi to get the treatment in AIMS. For them, AIMS is very cheap as it's a government hospital. You are charged almost nothing. And people from as far as Nepal, Bangladesh and very far off places come to Delhi. And this is what the result is then. People sleeping outside AIMS. Okay. Now, let's see. As you can see, especially in South Delhi, the number of cases are very high. So 9 in Gautam Nagar, 18 in Ayur Vigyan, 18 Masjid, 5 in Sangam Vihar and 5 in Badapur. So 202 total cases of chikungunya reported from South Delhi municipal zone, including South and West Delhi, out of total 105 cases in Delhi till September 10. So South Delhi is one of the worst states. One of the patients waiting for treatment inside AIMS. Now, a troubled history. Now, before I go further in the clips, I talk about now. Point is whom to blame. all of us, the public, the union government, the Delhi government, Municipal Corporation of Delhi, and Indian Railway too. We can see a lot of filthy, dirty area adjoining railway tracks, and Indian Railway has never taken any bold step, and even if it takes, they have never been very efficient. A lot of resistance within the political circle itself. So Indian Railway also must do something to improve the environment at joining the railway tracks. Now, why blame public? Common man, the public is the biggest victim and also much to be blamed for it. Public must realize that God help those who help themselves. Government is because of us. We are not because of the government. As we all know, democracy is of the people, by the people, and for the people. But why then we expect too much from the government? Why not the public keep the environment clean? Why public looks toward government to help them all the time? Public can take care of itself. Now also public is taking care of it. Now also public is taking care of itself. Government is hardly helping it. Government hospitals are already in shambles, very poor state. The healthcare delivery services are pathetic. And also we do not have adequate hospitals and the number of beds. So the public now also taking care of itself. They are going to private hospitals. So why then pay taxes? Now what public should do? Ask the government to take less tax. If it has to take care of its own health, then why pay so much of taxes? Why not let public have more money in its hand so that they can buy a good health insurance and get treated in a good private hospital in a comfortable and dignified way? Now, what's the solution? Health insurance is the solution. Governments, all, whether union, state, municipal, all have failed to deliver health services. Let public take its own health in its own hand. But surprising thing is, public cannot stop mosquitoes. Malaria, dengue, chikungunya can be eradicated, but cannot be eradicated. Since independence, the government has tried a lot to eradicate malaria, dengue, malaria basically, but it has never been possible. So now the health ministry says it can be controlled, but surprising, it has not been controlled since now also. Sri Lanka, which is a neighboring country of ours, is the only country which is now malaria free. It has been recently announced by the WHO. But India is still struggling with malaria, and now dengue and chikungunya has added to it. Now government can help here. It can help in fumigation, spray. Government can remove taxes from the mosquito repellent, mats, coils, etc., so that they become cheap. So we must realize that M is mosquito, and in Delhi it is M is MCD, Municipal Corporation of Delhi, which has failed miserably. Fumigation spray is the responsibility of the MCD and it has failed, we all know. Delhi government. Now much hype, mohalla clinics, they are not just enough. Out of the box solutions are required. Delhi is the capital of India. We are talking of medical tourism and we cannot even control mosquito borne diseases. Now preventive health is also the responsibility of the government. Now, private setup can be good in tertiary care, secondary care, but when it's come to preventive medicine, the responsibility is of the government. Now how the union government can help and what's its role. So the blame game is not good, as we have seen recently in the various TV channels. Political blame game going on. The union government must act like an elder brother with a larger heart and wisdom. Why every year the same story? Why not there is any discussion, plan, policy, vision? So now let's talk on other things. So this is where we were. This is one of the places in Dwarka. No fogging. This thing. So here we were. If we see the history, chikungunya was first reported in Calcutta and around 1963, and it has also been reported in Maharashtra 1973. Recently in 2006 the virus has re-emerged, and currently high incidence has been seen in Delhi, West Bengal, Karnataka and Telangana. Now the virus that is in circulation is changing. In 1963-73 it was of Asian genotype, 2006 African genotype, 2008 Eastern Central Southern African genotype, and 2016 is still to be known. As seen in various print media, the current chikungunya is also associated with a lot of neurological problems, and not many people suffering from encephalitis as well. Now, testing right for dengue and chikungunya. So let me make it clear. In chikungunya we have two kinds of tests. One is PCR, polymerase chain reaction, which has been marked with blue, and chikungunya serology. Now, how the PCR helped? What does it do? It detects the viral RNA, and it also detected very fast, that is within 3 days. But its cost is high, rupees 1,500. Whereas chikungunya serology, which has been marked in red, it detects antibodies produced in response to virus. At least 6 to 7 days are required after symptoms appear, and it costs just 600. Now, same is with the dengue. Dengue NS1 antigen ELISA based